Hello friends, welcome to the show Talk with your Doc. I am Dr. Prashant Jani and with me is Dr. Kushal Dighe. Dr.
Hello.
Kushal Dighe is an interventional cardiologist at Thunder Bay Regional Health Science Center. Today we are going to talk about heart disease. In our last episode we talked about various etiology and risk factors for the heart disease. Today we are going to talk about various signs and symptoms of heart disease, various investigations and treatment modalities. And Dr. Dighe is going to enlighten us about that.
Sure.
Thank you, Dr. Dighe, for coming again on the show. We really appreciate your time.
Thank you for having me.
In the last episode, we talked about hyperlipidemia, smoking, sedentary lifestyle, or family history as a risk factor for the heart disease or coronary artery disease.
Right.
And we left the episode where we were talking about the signs and symptoms of the heart disease.
Right.
So now if somebody has about 30 to 40% atherosclerosis of the blood vessel of heart, then what will be the signs and symptoms, and what will be the signs and symptoms of somebody who has say 70-80%?
Sure. So with 30 and 40% of stenosis in the coronary arteries, the patient will have no symptoms at all because all matters is the blood flow. So even with a 30% stenosis, the coronary arteries get enough blood flow. It has some cardiac reserve. So even when the patient is doing physical exertion or exercise, they still receive enough blood supply, so they won't have any symptoms.
So somebody with the heart disease won't have any symptoms.
Yeah, so this is like atherosclerosis occurs over many years. So it begins at an early stage, but patients will not exhibit any symptoms unless the coronary blood flow is reduced because of severe stenosis.
So when you say severe, what does that mean?
So in general terms with us, the severe is anything that is typically over 50% on the left main coronary artery or typically over 70% in the other coronary arteries.
So if somebody has a say severe stenosis of 50% or more,
Right.
what will be the signs and symptoms when he is just resting, and what will happen when he does an activity?
So when they are resting, they still have good amount of blood flow to their heart. So they will not exhibit any symptoms at that point.
Okay.
So when your cardiac demand increases, when they're doing more physical activities and the heart rate increases to keep up with the demand of their cardiac, with the demand of the body's work, at that time the heart needs more blood supply for itself to do the work. And because they have 70% stenosis, they will have relatively less amount of blood flow flowing to that part of the heart, and hence they will have symptoms of angina.
So when you say angina, what does that mean?
So angina is just a medical term for chest pain that happens in the substernal region that typically, we call as typical angina, that comes with exertional activities such as walking or doing exercise or climbing stairs, and that is relieved when the patient stops doing those activities or takes the nitroglycerin spray. And these actually symptoms can also occur in patients with emotional outbursts. So emotion and exercise is similar in terms of cardiac disease, yes.
So what is the difference between angina, heart attack, and cardiac arrest?
Sure. So angina is just a symptom. So this patient is not an impending heart attack. So he has stable angina, meaning he has this narrowing of the artery, which is about 70%. And every time he walks or does physical activity, he feels chest discomfort or heaviness. That typically is in the front of the chest. It can radiate to the left arm or the jaw or the back. It can be accompanied with shortness of breath. Some people may feel more of an epigastric pain or discomfort, or they feel as a heartburn sensation. But these symptoms typically will occur with exertion.
Okay.
When, for example, if that 70% artery is blocked 100%, so now there is no blood flow to the rest of the heart muscle, and that's when we say the patient is having a heart attack.
So up to 70%, whatever the chest pain that is on exertion is called angina.
That's right.
And when you get severe chest pain just by standing or sitting,
that means that the patient has occluded the rest of the artery vessel, and now the stenosis is almost 100%, and there is lack of blood supply to the heart muscle. And that's when we say the patient will have more symptoms, similar symptoms of chest pain, heaviness, but now they will occur even at rest when the patient is not doing anything. typically the patient will also feel sweating, nausea or vomiting with these activities, sometimes lightheadedness, and this is when we say this patient is having a heart attack.
Heart attack. And so, what is the cardiac arrest then?
So cardiac arrest is a next form. So typical, the cardiac arrest can occur in different scenarios, but the commonest reason for cardiac arrest is a heart attack.
Heart attack.
So if somebody has a 100% blocked artery and has a heart attack, and now the heart doesn't get any blood supply,
Right.
and so that part of the heart is prone to arrhythmias,
Right.
and these arrhythmias can be life-threatening, meaning heart just kind of goes fast by itself in a very erratic heartbeat, and effectively the heart is just trembling. So there is no cardiac output, and hence the patient has no blood supply to the brain, and the patient will collapse with a
So
cardiac
heart
arrest.
stops functioning virtually, probably.
That's right.
Right. So that's the cardiac arrest.
That's right.
So now we have an initial symptom as pain on exertion,
Right.
and then the blockage increases, and then you kind of have a pain at rest,
Right.
and then you have a heart all of a sudden stops and the patient collapses.
That's right.
Now this pain in the chest, how do we differentiate this chest in the pain from the other causes of chest in the pain? Like say indigestion also can cause sometimes pain
Right.
in the chest, and patient may misdiagnose or may think that this is just like a indigestion chest pain. So what they should do?
It's difficult sometimes to differentiate between these symptoms, especially for the patient who have never experienced this before.
Chest
right.
pain.
So if the patient never has angina and all of a sudden has this indigestion feeling, they may not be sure, is this indigestion or is this a heart attack happening? But again, the typical thing that will happen with the heart attack is this pain will get worse when they're doing some physical activity. Whereas indigestion, sometimes you can correlate, oh, I ate some different kind of food, and maybe you're somebody who's prone to indigestion symptoms may get more severe indigestion. So it is sometimes very hard to differentiate. The indigestion again doesn't lead to sweating. Typically a heart attack will lead to a sweating. So there are some subtle symptoms that the patient can see that this is a heart attack. I tell my patients, if you are in doubt, don't risk and don't be your own doctor. You better call for help, call for 911. Let the medical personnel decide what's the underlying problem.
Right. Now, if you see somebody collapsing in front of you with a myocardial infarction or cardiac arrest,
Right.
what should be done next?
So the first thing is, it's a CPR. They have to learn to do CPR, and there are a lot of programs in the community that teach general public how to do CPR. There are defibrillators available at some public places as well that can help this patient get out of that cardiac arrhythmia, ventricular fibrillation typically, with a cardiac shock. That is.
But if those facilities are not available,
so those is first
say I'm in a movie theater and somebody collapses in front of me.
So typically you look for a pulse. So you look for a pulse in the jugular, in the internal carotid artery, or in the peripheral pulse. If you don't find a pulse, you see the patient's not breathing, you start CPR promptly, and you designate somebody else. Or if you're alone with this patient, then you call for 911. You tell them the address things, and you start the CPR until the paramedics arrive and take over the patient's care.
Thank you, Dr. Dighe. We'll take a short break and then come back for the next part of the discussion.
Sure.
Thank you. Please stay back and we'll come back after a short break.